Let's palpate the gluteal area. So I typically start greater trochanter, back of the greater trochanter space. Here's the sciatic nerve. It's pretty thick. It's probably that thick right here on her. And it's going down this way. The top of the greater trochanter is where the piriformis comes out, and I'll typically just go across. And then once I'm across here, I'm trying to feel for the sciatic nerve. The glute max is the only thing on top of the sciatic nerve here. Right here, it's glute max and piriformis. I can feel that I lose some of the cleanliness of palpation right there. So that's the piriformis. Here's the piriformis edge. And then the greater trochanter is right there. So it goes out this way. Yeah, there's the lip of the piriformis. Come on this side, James. Or you can come over here if you want to. So this is all the sciatic nerve underneath it. On top of the piriformis, here's the inferior gluteal nerve. It comes out from right here and it goes on top of the piriformis and goes up. So she's got a little bit of adhesion when I go to bow the inferior gluteal nerve that way. Doesn't want to go. Then on top of the piriformis, the superior gluteal nerve comes out. Right there. And it goes out this way. I forget if it's on top or underneath the glute medius. It doesn't necessarily matter, practically speaking. I feel it there, and then I start to lose it. Then, if greater trochanter is right here, so superior gluteal nerve, inferior gluteal nerve, sciatic nerve, piriformis stops right there. There is a branch of the lateral iliohypogastric nerve, which is right here. If this is the greater trochanter, this is the lateral iliohypogastric nerve and or the posterior TFL. It doesn't necessarily matter. You'll feel tension or like there's a spaghetti that's just glued down to the tissue down here that you'll want to check. You could also have the posterior femoral cutaneous nerve, which is medial to the sciatic nerve on this side. So if her sciatic nerve's here, posterior femoral cutaneous nerve comes out underneath the piriformis and goes down parallel to it. Right here, it's a little stuck on her. So she's got some adhesion right there. And then you could also have the inferior gluteocutaneous nerves, which I haven't paid much attention to lately, that come out from the glutes and go up on top. Here's one of them. Going up this way. So sometimes if people have, and this will be superficial to glute max. So if people have something down here and they put pressure there, that's what they could be feeling there. And then you could have cluneal nerves from up top. That guy coming down from the iliac crest. Going down this way. So that's one of the middle cluneal nerves. So beautiful. Sciatic nerve, posterior femoral cutaneous nerve, inferior gluteocutaneous coming out from the bottom around glute max on top. Piriformis muscles right here. Inferior gluteal nerve comes out from where the sciatic nerve comes out and goes over the top of piriformis. Superior gluteal nerve comes out from the superior piriformis and goes around that way. One of the cluneal nerves comes out this way. Lateral iliohypogastric branch is right here, somewhat posterior and above the greater trochanter. Practically speaking, you just palpate and you feel for stuff, things that don't feel right. You feel for noodles that are glued down and irritated. Then when you're going to treat, for the sciatic nerve, the knee is straight. For a lot of this other stuff, you're going to do an external rotation move. So the knee goes up towards her chest and then the foot is externally rotated, brought down to the ground in order to tension pretty much any of this tissue. You could even do that for the sciatic nerve if that's what pulls it tight. And you're getting next to the nerve, you're setting depth into it, and then you're bowing it in a direction it doesn't want to go, and that's how you're treating any of this stuff. So start with that, and we'll do a nicer drawing and video at a later point in time.